Okay, welcome to episode 3 of our podcast series. As you know, we're focusing on medicine, and my goal is to provide basically free education for me and you guys. Um, and in these next years, hopefully, I can have a complete series of a medical degree for you all. And it's without plagiarizing, it's without using anyone's data, it's without copying any university. It's just by me and ChatGPT talking. So, yeah, I'm really excited for this episode. Okay, and I will group these things into better playlists and categories along, well, in the next few weeks or so, or months and years to come. And so you guys can have basically a better understanding of how maybe you would like to listen to these, what order, because at the moment the order might be a bit confusing. So yeah, as you guys know, or maybe not if you're new, I'm also gonna be doing a more completely chaotic, curiosity-driven series, and I'm gonna do that at least once a week, which I'm really excited about. If this is a very niche topic for you guys, you might really enjoy that one. Without further ado, though, let's get on with it. Today's topic is behavior changes for lung and heart health. A really nice topic, perhaps slightly a more relaxing topic than what we've talked about in the last couple of episodes. So, as you know, I'm the host, and to introduce my guest, Mr., Mrs. slash whatever pronouns you want, ChatGPT. Can you listen to us? Are you here?
Hello, thank you for having me. I'm excited to dive into today's topic. It's a pleasure to join you and discuss how behavior changes can impact lung and heart health. Let's get started.
Excellent, excellent. Okay, amazing. So, can you explain to us some why is it important to be healthy? And what kind of changes can we do to be healthy? And what specific changes can we do to have healthy lungs and heart? Give us a broad understanding, give us a big picture.
Staying healthy is crucial because it helps us live longer, feel better, and avoid diseases. For healthy lungs, it's important to avoid smoking, reduce exposure to pollutants, and stay active with regular exercise. For a healthy heart, maintaining a balanced diet, managing stress, and regular physical activity are key. These changes can significantly improve overall health and reduce the risk of chronic conditions.
Interesting. Okay, what about if someone's depressed and for them it's not as important to be healthy and it's hard?
That's a good point. Depression can make it harder to prioritize health, as it often affects motivation and energy levels. It's important to address mental health first, possibly with professional help. Small, manageable steps, like regular walks or connecting with supportive people, can gradually improve both mental and physical health.
Interesting, interesting. Okay, so um, are there any models of perhaps health behavior that we can kind of use as physicians, or perhaps people can have in their minds in their everyday lives, even if they're not physicians, that they can kind of follow?
Yes, there are several models that can guide health behavior. One is the health belief model, which suggests that people are more likely to adopt healthy behaviors if they believe they are at risk for a condition and believe that the benefits of taking action outweigh the barriers. Another is the trans-theoretical model, which describes stages of change from pre-contemplation to maintenance. These models help people understand and navigate the process of adopting healthier behaviors.
So the trans theoretical, explain it to me again.
The trans-theoretical model, also known as the stages of change model, describes how people move through different stages when changing behavior. The stages are pre-contemplation, not yet considering change; contemplation, thinking about change; preparation, planning for change; action, actively making changes; maintenance, sustaining the new behavior.
Interesting. Sorry,
Behavior,
continue. Continue.
no worries. The model emphasizes that people progress through these stages at their own pace and may move back and forth between them. It's a helpful framework for tailoring interventions and support based on where someone is in their journey of change.
Interesting. What about, I know a scientist called Fisher in the 1990s has the IMB model. What's that?
The Information Motivation Behavioral Skills model, developed by Jeffrey and William Fisher in the 1990s, suggests that adopting health behaviors requires information, accurate and relevant knowledge about the behavior. 2. Motivation,
Mhm.
personal and social motivation to adopt the behavior. 3. Behavioral skills, the practical skills and confidence to perform the behavior effectively. It's a useful framework for understanding how people can successfully change their health behaviors.
Interesting. I see. So they need the information. So they need to know eating deep fried food is bad for you. And they need to know. This is a trick, guys. I've been noticing because the last 3 or 4 years, guys, I've been really focusing on making my diet better. But the thing is, and if a friend's listening, they know this is like a bit of a tricky one. And this is a good example. I mean, I know it's not everyone, but this is a good example on how basically um I what I perceive as healthy might not be actually healthy. And we think that it's really easy, like people just should eat fruit and veg and they shouldn't eat cakes and like fried chicken. Guys, it's not as easy. Like maybe I'm just really, really dumb. But I've seen other people with at it too. Like I think that eating lots of cheese is like great. Some friends of mine think eating a lot of cheese is really bad. Other people think eating a lot of eggs bad. Other people think eating no eggs is bad. So and it's tricky. Like it's tricky. It's also like, well, is eating what's the difference between eating a kebab, like bread, rice, and chicken, with eating uh, chicken breast and rice like boiled in your house? Like my point is, it's hard and the information is a big thing. And yeah, I think yeah, I'm just saying because a lot of people critique it and they're like, people know what they should do, they just don't do it. Guys, I'm not sure. Like every month I learn a few new things about diet. So yeah, anyway, I just wanted to give this as a kind of um parenthesis. Okay, so you said they need motivation. What's motivation?
Motivation is the drive that compels someone to take action. It can be intrinsic, coming from personal satisfaction and internal rewards, or extrinsic, driven by external factors like rewards or recognition. In the context of health, motivation can come from wanting to feel better, live longer, or avoid illness. It's what keeps someone committed to making positive changes.
Wow, I love that you mentioned intrinsic and
I'm
extrinsic.
sorry, but you've hit the.
Yeah, so it reminds me of Alfie Kohn's book, Punished by Rewards, when you
I'm
mentioned,
sorry, but you've hit the daily limit for
um,
advance.
yeah, when you mentioned extrinsic and intrinsic. As a parenthesis, guys, by the way, let me know if you prefer the standard voice or the advanced voice for our guest. Yeah, and I can do the necessary changes. I think this would be a big good podcast for the advanced voice, for instance. Anyway, having said that, yeah, when you mentioned extrinsic and intrinsic, it reminded me a lot of Alfie Kohn's Punished by Rewards. Guys, if you haven't read it, it's an amazing book. I've personally read it because of Fidias. Fidias is a European Parliament member, and his high school teacher is one of his assistants, actually, in the, well, really big helpers. I don't think they have a hierarchy, so assistant, I don't know if it's the best word. Um, but yeah, he was mentioning it in a podcast about education, and it's amazing. So anyway, so without going into too much of a tangent, could you explain to us more about extrinsic and intrinsic motivation, and briefly, maybe in 1 or 2 sentences, just kind of explain to us behaviorism and where it came from, and who started thinking about these things?
Yeah, absolutely. So, intrinsic motivation comes from within. You do something because you find it meaningful, enjoyable, or personally rewarding. Extrinsic motivation, on the other hand, comes from outside incentives, like rewards, grades, or social approval. Behaviorism, which ties into this, is a psychological approach that focuses on observable behaviors rather than thoughts or emotions. It was pioneered by figures like John B. Watson and later developed by B.F. Fried. Essentially, behaviorism emphasizes how external factors influence our actions, which is why Alfie Kohn critiques reward-based motivation in Punished by Rewards. Do you think intrinsic motivation is undervalued in today's education system?
Yeah, 100%, dude. Nowadays, you're trying to make people scared in order for them to do the thing they're supposed to do, which is not. It's like you need to teach the people how to fish, dude. You need to teach the people how to fish. Yeah. So, um, okay, it's great that we've mentioned that. Um, Perhaps I would like to ask, what about schema and in behaviorism? And do you think behaviorism goes against kind of um, giving people intrinsic motivation, which ultimately is not something you can give, but something you can kind of promote people to give to themselves almost?
Yeah, I totally get what you're saying. Fear-based motivation just makes people jump through hoops instead of actually wanting to learn. And yeah, the whole teach a person to fish thing, spot on. Now, about schema and behaviorism. So technically, schema is more of a cognitive psychology concept, not
Schemer, guys.
strictly behaviorist. A
Be a
schema
schemer.
is like a mental framework we
It's
use
cool.
to
We can learn
interpret
a
and
lot.
understand the world. Behaviorism, on the other hand, doesn't really deal with internal thought structures like schemas. It mostly focuses on external behavior, what can be seen, measured, and conditioned. And yeah, behaviorism can actually clash with intrinsic motivation. If you're constantly reinforcing behaviors with rewards or punishments, people start depending on those external triggers instead of developing their own drive. That's kind of what Alfie Kohn argues, that extrinsic rewards can undermine intrinsic motivation. So instead of getting
Interesting.
people excited about learning, you just train them to chase rewards or avoid punishment. Do you think schools should shift more toward fostering curiosity rather than just rewarding
Yeah.
performance?
Yeah, 100%. But I want to go a bit in 2 or 3 sentences. If you could explain a bit more. Do you think actually, because I've heard a lot of critique about behaviorism, can you define behaviorism for us? And I wasn't talking about schema, but schemer, BF schemer, Skimer. I think is how his name is spelled. And could you, so what do you think about Alfie Kohn's idea on behaviorism being heavily linked with extrinsic rewards and extrinsic motivation? Is it always the case? Yeah, 2 3 sentences.
Oh, I see what you mean now. First, let me clarify behaviorism. Behaviorism is the psychological theory that all behaviors are learned through interactions with the environment, mainly through conditioning. It downplays internal thoughts and emotions, focusing instead on observable behavior. The two main types are classical conditioning, Pavlov's dogs, and operant conditioning, Skinner's work with rewards and punishments. Now, I think you meant BF. Skinner was one of the
Yeah,
most influential behaviorists, and he developed operant conditioning, the idea that behavior is shaped by consequences. Positive
yeah.
reinforcement, giving rewards, strengthens
Parallel
behavior, while
sleep.
punishment discourages it. Alfie Kohn critiques behaviorism because it relies heavily on extrinsic motivation, rewards,
Yeah,
grades, punishments, rather than fostering intrinsic motivation.
yeah,
He argues that when people are constantly rewarded, they start doing things just for the reward
yeah,
rather than for
yeah.
personal interest or
100%.
meaning. That can undermine creativity, curiosity, and long term engagement. But is
Yeah.
behaviorism always tied to extrinsic rewards? Not necessarily. Some argue that reinforcement can be used wisely to develop intrinsic motivation over time.
Hmm.
For example, praising effort instead of just outcomes can help someone internalize the value of hard work. Also, early
Mm.
rewards can sometimes help build habits that later become self sustaining. Do you think extrinsic rewards can ever be useful, or do they always risk killing intrinsic motivation?
This is so interesting, and I know, guys, we're talking about the lungs and health and heart, but I think it's important since we're at this IMV model. Um, well, dude. I mean, the story about de-incentivizing with I think it's in Alficon's book. I personally first heard it from Vivian's high school teacher about this old. Well, it's not a good story. First of all, like there's an old guy. and these kids have real fun throwing rocks at the guy after they finish school and at the guy's house, which is a really bad thing, obviously. But the kids get a rush. They're being mischievous, little rascal 13-year-olds, and they really enjoy it, which is a bad thing. We can all agree. However, they do it. They have intrinsic motivation to do this thing, and then this guy gives them the first time they do it, he gives them €2, £2 or whatever. He gives them a coin. He says, "Thank you for throwing rocks at my house. This was good." And the second day, they're like, "Oh, we should go again. We should go again." They go throw rocks. They want more money. They're really excited. So they go, throw rocks, and the guy says, "Thanks for throwing rocks at my house. Give £1.50 now." And the kids are a bit confused. They're like, "Why not £2? Why £1.50?" And then the next time, and again, we're going back to the long and hard, guys. Don't worry. And then the next time, the kids go £1. Next time, 50p. Well, next time they never win again. Which is a great story about how this old man de-incentivized them. He replaced their intrinsic motivation of just getting a rush and liking the action for what it is for itself, which is bad action, but it's still the action for itself. And he replaced it with money, basically. It's de-incentivizing. And you can see this in companies, you can see this in school. Suddenly people don't want to learn philosophy and science because it's interesting and because for what it is, that it allows them to explore the world. Suddenly they do it to get an A and to get a to feel validated by the parents. And dude, parents, it's their job too to like. I mean, it's not great when parents you know only validate their children when so conditionally if they just get an A or whatever. Anyway, I just wanted to mention the story since we're on the topic, and since we're talking about the IMB model, which to remind you guys, information, motivation, behavior. I want to understand how these kind of, and if you want, guys, I'll put a picture. I want to understand how behavioral skills is in the middle of this. So we have information, motivation, behavior around, and then behavioral skills in the middle. Can you explain this to me? Two sentences or three is enough.
That story is such a great example of how extrinsic rewards can replace and ultimately kill intrinsic motivation. That's exactly what Alfie Kohn warns about, turning something people naturally enjoy or are driven to do into a chore they only do for a reward. Now, about the IMB model, so in the information, motivation, behavioral skills model, behavioral skills sit in the middle because they act as the bridge between motivation and actual behavior. Having the right information and motivation isn't enough. People also need the skills to put that motivation into action. Without behavioral skills, motivation might not translate into real change. Do you think schools focus too much on just information and motivation without actually teaching the skills to apply them?
That's an interesting question. I'm not sure. Um, well, I guess you can learn some theoretical skills, but yeah, maybe it's better if I like self-directed learning. I like Peter Gray's stuff. I like Sudbury Valley School. If you guys search what these are, this is basically an alternative school, well, where you're allowed to explore what you're actually gonna learn, basically. I think that kind of naturally allows students to use these motivation as like a factor that's going to allow them to study more effectively and to use their knowledge too, because they're obviously interested in it. But I don't understand why in this model behavioral skills are in the middle. If you could explain to me in two sentences or so.
Yeah, I see what you mean. Self directed learning definitely aligns with intrinsic motivation, since students follow their curiosity instead of just chasing grades. Now, about why behavioral skills are in the middle of the IMB model, it's because they are what actually turn motivation and information into behavior. You can have all the knowledge
I
in the
see.
world and even the motivation to act on it, but without the skills to apply it, nothing really changes. For example, in health education, someone might know smoking is bad, information, and even want to quit, motivation. But
Mhm.
without strategies to handle cravings and stress, behavioral skills, they might fail to change their behavior. So the model basically says knowledge and motivation alone aren't enough. People also need the practical ability to put them into action.
Got
Does
it.
that make sense in the way you see learning and motivation?
Yeah, that makes a lot of sense. What about I know another model, COMB, and that has to do with behavior change. And it's like a wheel, from what I understand. If you could explain that to us. I think it's Mishi. I don't know, I may be butchering the name, but I think something like that in the 2010s or so.
Yeah, you're talking about the COM-B model developed by Susan Mishi and colleagues around 2011. It's a behavioral
Mhm.
change model that explains how three main factors interact to influence behavior. Capability, C, a person's physical and psychological ability to perform a behavior.
Mhm.
Skills, knowledge, strength. Opportunity, O, external factors that make the behavior possible or difficult, social and environmental influences.
Mhm.
Motivation, M, internal drives that influence behavior, habits, emotions, goals, intentions. These three factors work together in a wheel-like structure to determine behavior, B.
Mhm.
If one of these elements is weak, behavior change is less likely. For example, someone want to exercise, motivation, and have access to a gym, opportunity, but lack the physical ability or knowledge of how to train safely, capability, making behavior change harder. It's a flexible model used in public health, education, and even corporate settings to design interventions that actually work. Do you think this model captures behavior better than just focusing on motivation alone?
Interesting. Capability and opportunity. Um, I guess capability is similar to behavioral skills in the IMB model. If it's not, then explain why to me. And opportunities, and yes, opportunity is an interesting kind of addition, I guess. And I guess you could include, yeah, yeah, that makes sense. Could you include information inside opportunity in a way? If you could explain to me very briefly.
Yeah, you're spot on. Uh, Capability in the COM-B model is very similar to behavioral skills in the IMB model because both focus on whether a person has the necessary skills and knowledge to act. The main difference is that COM-B explicitly includes both physical and psychological ability,
Mm,
while IMB focuses more on cognitive and learned skills. As for opportunity, you could argue that information is part of it, but
mm.
only in a certain way. If information is accessible and available in a person's environment,
I
like
see.
clear health guidelines or good education systems, it becomes an opportunity for behavior change. But if it's about understanding and using that information, then it falls more under capability in COM-B. So, in a way,
Interesting.
opportunity is about external conditions, while capability is about internal ability to act on those conditions. Does that
Amazing.
distinction make sense?
Yeah, that makes a lot of sense, dude. And yes, guys, I cannot pictures if you want. I know I say this in every podcast, but at the moment I'm not until someone wants me to. But yeah, so I can see here in the wheel of the COM-B model, that by the way, COM guys, capability, opportunity, motivation, COM, B behavior, and I can see that we've got two different types of motivation, automatic and reflective. So if you could go very briefly explain that to us, perhaps, yeah, and you mentioned about the difference between having the physical capability and the psychological kind of capability, which makes a lot of sense and maybe isn't covered when we say information. Um, and yeah, I think from what I can see from the wheel, it's the same with opportunity. It's having the physical opportunity, but also the social opportunity. So that's great too. It's like if you're in a place of big poverty, it's not enough if you just say, if you just have the opportunity to have access to information such as what's the best foods to eat if you don't have the foods, I guess. So if you can very briefly touch on that too.
Yeah, exactly. You're breaking it down really well. Capability and opportunity both have those two layers, physical and psychological for capability, and physical and social for opportunity, which makes COM-B super practical for real world situations like poverty, education, and health. Now, about motivation, it's split into automatic and reflective. Automatic motivation is habitual, emotional, or instinctive. It includes things like cravings, fear responses, or subconscious habits, stuff that happens without much thinking. For example, feeling anxious and automatically reaching for a cigarette. Reflective motivation is conscious and deliberate. It involves reasoning, planning, and goal setting. For example, deciding to quit smoking because you've weighed the long term health risks. Both types work together. Automatic motivation can drive quick decisions, while reflective motivation helps with long term change. And yeah, your poverty example is perfect. Knowing what's healthy isn't enough if physical opportunity, access to food, or social opportunity, community support, financial stability isn't there. Would you say most bad habits come more from automatic motivation than reflective?
I'm a bit confused with the differences. I can't lie. Um, could you, in one or two sentences, kind of explain it again? I'm so sorry.
No worries at all. Automatic motivation is driven by habits, emotions, and instincts. It's unconscious and reactive, like craving junk food when stressed. Reflective motivation is conscious and deliberate, based on reasoning and planning, like deciding to eat healthy because you want long term benefits. Basically, automatic is impulse driven, while reflective is thought driven. Does that help?
I see. Interesting. That's very interesting, dude. And I mean, I know you ask me questions sometimes. Guys, let me know. I mean, I answer. Sorry if I don't answer your questions sometimes. The questions directly, guys. Perhaps if you want me to, I can. Um, I'm. But yeah. I mean, what sort of podcast is it if I don't listen to my guests, right? Um, could, I mean, perhaps independently of consciousness. Anyway. So, okay, could we talk a bit about the Oh, by the way, sorry. Before I do that, yeah, you're right. It's almost like automatic motivation is like kind of nearly not the subconscious, but it almost feels like it. Like, perhaps not. Perhaps I didn't understand correct, and then reflective is more so kind of more. It's more so kind of conscious.
Yeah, you're totally on the right track. Automatic motivation isn't exactly the subconscious, but it definitely operates beneath full conscious control.
Yeah.
It's like instinctive reactions, habits, or emotional responses that happen quickly and without much thought. Reflective motivation, on the other hand, is much more conscious and deliberate, involving reasoning, self awareness, and intentional decision making. So, yeah, automatic motivation feels almost subconscious, while reflective motivation is clearly conscious. Does that fit with how you were thinking about it?
Interesting. Okay. Well, it's an interesting. It's they're not equal, the same, but it's interesting to like distinguish a bit that more is more conscious. Okay. So what about the trans theoretical? You mentioned it already. Trans theoretical model, which is like focusing on stages of change. And could you describe this a bit to us? Maybe give us some background knowledge about it too in two or three sentences.
Yeah, for sure. The trans-theoretical model, TTM, also called the stages of change model, was developed by Prochaska and Di Clemente in the
Mhm.
late 1970s to 1980s. It describes how people move through different stages when changing behavior, rather than just flipping a switch. The five main stages are pre-contemplation, not thinking about change; contemplation, considering change; preparation, getting ready to change; action, actively changing behavior; and maintenance, sustaining the change. Some versions include relapse, where someone falls back into old habits before trying again.
Yeah.
It's widely
What you
used
were
in
talking
health
about.
psychology, addiction recovery, and behavior change programs because it recognizes that change is a gradual process. Does
Yeah.
that structure make sense to you?
Yeah, yeah, and sorry for repeating this because you kind of already answered it beforehand, but it's good to kind of refresh it. And I can see here in front of me a beautiful diagram too about it. So, okay, so when someone relapses in the trans-theoretical model, where do we fit this into the situation? Does it create like a cycle of things? If you could explain to us like really briefly.
Yeah, exactly. Relapse isn't always a separate stage, but it's often shown as a loop back to an earlier stage in the cycle. If someone relapses, they don't necessarily go all the way back to the beginning, pre contemplation, but they might return to contemplation or preparation before trying again. It basically shows that behavior change isn't always linear. It's a process where people move forward, sometimes slip back, and then reattempt until the change sticks. Does that match what you're seeing in the diagram?
I see, I see. This makes sense. This makes sense. Um, yeah, it does. And so what about, so we have different components, basic components when it comes to promoting health. We have, so so we have individual components to promote health. We have social components, and we've got interpersonal components. What can you explain to us these components, perhaps really briefly?
Yeah, absolutely. When promoting health, we usually look at three main components. One, individual components. These focus on a person's knowledge, beliefs, and behaviors. This includes things like education, personal motivation, and self care habits, e.g., choosing to eat healthy or exercise. Two, interpersonal components. These involve relationships and social support from family, friends, and peers. For example, having supportive friends who encourage healthy habits or a family that prioritizes good nutrition. Three, social components. These are larger societal factors like culture, economic conditions, healthcare access, and public policies. Things like anti smoking laws, urban planning that encourages exercise, or affordable healthcare
Mhm.
all shape public health on a
I
broad
see.
level. Each of these layers interacts. Individual choices are influenced by interpersonal support and social structures. Does that
I
breakdown
see.
make sense to you?
Interesting. So, yeah, I wonder. So, I'm a bit confused with the difference between individual and interpersonal. Is inter? Yeah, could you very briefly kind of explain to me?
Yeah, for sure. Individual is about you alone, your
Mm,
knowledge, habits, and personal choices. Interpersonal is about your relationships with others, how friends, family, or peers influence your health
I
decisions.
see.
So, for example, choosing to eat healthy is individual, but your family encouraging or discouraging it is interpersonal.
Yeah,
Does that clear it up?
I see. And then social is even bigger than the family kind of scale.
Exactly.
Mm-hmm. Yeah, that makes sense. That makes.
Social is the big picture environment, things like culture, policies, economy, and healthcare systems that affect everyone, not just individuals or families. It's the
Mhm.
wider context that shapes both individual and interpersonal health choices. That
Yeah,
makes sense?
that makes a lot of sense. So yeah, we can do changes in our lifestyle. I understand, like eat better, sleep well, and regular physical activity. You know what always confuses me a bit though when it comes to, I know it's very popular too, but all these ways to be better. Um, I feel like they're amazing. Sometimes I don't know, guys. Like when I see wars happening and I see people in poverty and all of that, like ah, it just really like I mean I I don't know. I don't want to just start judging people. Yeah, I don't just want to like start judging people, but sometimes it's really hard for me to like think in depth for my personal self. Like, how can I have this perfect sleep and perfect health and perfect this? Because it's like other people that don't even have them. It's hard for me to like hyper focus on how I can create the best for myself. I don't know if anyone else got this experience. I kind of try. I've talked about this with people, and I personally kind of try to reverse it to the healthier I am, the more I can work productively to help others, maybe through medicine or through something else. What are your thoughts on this? Like, just very briefly.
I totally get what you're saying. When you see so much struggle in the world, it can feel almost selfish to focus on optimizing your own life. But
Yeah.
I think the way you're reframing it is really powerful. Taking care of yourself isn't just for you, it's so you can be stronger, more effective, and better equipped to help others. If you're healthy, well rested, and in a good place mentally, you'll have more energy, clarity, and resilience to contribute meaningfully, whether in medicine, advocacy, or whatever path you choose. It's not about perfection, just about being in the best state to make a difference. Does that perspective help at all?
Interesting. Yeah, yeah, that's basically what I was trying to say. But you're basically the wisdom of the crowd. I think I think that's what you are. And guys, I've been talking about this in the last episode too at the end. I think ChatGPT is beautiful because it's the combination of knowledge of all of us. I mean, it's going to come to a point, if it hasn't already, that it creates even more information from what it has now. From what I understand, maybe I'm wrong, but from itself, but yeah, if you are a wisdom of a collective wisdom of us, so it's beautiful how when humans come together we have all this knowledge. But anyway, that was a small parenthesis. Can we talk about smack, shove, and nudge? So how to facilitate healthier choices? Because smacks is like that, like it's legislation. It's like you ban these, you put drinking age limits and COVID restrictions, stuff like that. And whereas on the other hand, like nudges are a bit, make the healthy options more visible, and shoves are in the middle. Could you kind of briefly explain that for us?
Yeah, exactly. Smassy, shove, and nudge are different ways to influence people toward healthier choices, from strict enforcement to gentle encouragement. Smack, structure, mandate, align, control. This is the most forceful approach, using laws and regulations to restrict unhealthy behaviors. Think banning smoking indoors, setting drinking age limits, or COVID lockdowns. People must comply. Shove. This is a middle ground approach that pressures people toward healthier behaviors
Mm.
without fully forcing
Like
them.
tax,
Things like
fat
higher
tax, sugar
taxes on
tax.
sugary drinks or requiring
Yeah.
calorie labels. It doesn't ban choices, but makes the unhealthy ones harder or less appealing. Nudge. This is the lightest form of influence, using subtle design changes to make the healthier choice the easier one. Think placing fruits at eye level in grocery stores or defaulting to healthier
Mm,
options in menus.
mhm.
People still have full freedom, but the environment
Yeah,
gently steers them toward better decisions.
perfect.
The idea behind all of these is to shape behavior without completely removing choice, just varying in how much pressure is applied. Do you think nudges work
So
better than
interesting.
strict rules, or
Wow.
do we need both?
This is such an interesting concept. And yeah, I was going to ask you, so do you think that, um, what do you think is perfect for a parenting style? Because I think nudging is probably like the best, because smacking, sometimes people were going to grow up just fine, but because the parents were eliminating certain choices from their lives, they kind of want to do what they couldn't do now, even if it's something bad, like, smoking. So I wonder, like, what do you think there's a ratio? Do you think it's 100% just nudging as a parent? Um, yeah, what do you think, briefly?
That's such a great question. I don't think it's 100% nudging, but I do think too much smack style control can backfire. Like you said, kids might rebel and do the very thing they were restricted
Yeah,
from. A good parenting ratio might be mostly nudging, like 70 to 80%, with some shove, maybe 15 to 20%, and a little smack, 5 to 10% for serious non negotiable safety issues,
yeah.
like no playing in the street, no drunk driving. Nudging works well for long term habits like making healthy food the default
Mhm.
or encouraging reading over screens. But sometimes a shove is needed, like setting limits on junk food or screen time. And
Yeah,
in extreme cases, a smack style rule is necessary, like stopping dangerous behaviors outright. So
yeah,
mostly nudging, some shoving, and a tiny bit of smack when absolutely needed.
yeah.
Does that sound like a good
Yeah.
balance to you?
And guys, by the way, it's important to actually say we're not talking about physically shoving and smacking. It's like it's just metaphorical. Like it's about, like we said, like ChatGPT said, it's about smacking equals eliminating choice. It doesn't equals like physical abuse. So it's important to clear that up. But yeah, that sounds amazing. Can you give an example of nudging people towards something, like, let's say, nudging people towards not smoking?
Yeah, great point. Smack, shove, and nudge are just metaphors, not physical actions. For nudging people away from smoking, you'd use subtle environmental cues rather than outright bans. Some examples: placing nicotine free alternatives like gum or patches near checkout counters instead of cigarettes. Making smoke free areas the default so smoking requires extra effort, like going to into a designated area. Using positive messaging instead of don't smoke, signs could say breathe fresh, stay healthy. Redesigning cigarette packaging to be less appealing, like removing branding and using plain neutral colors. These all gently steer behavior without removing choice. Do you think nudging alone would work, or do we also need some shoves and smack style rules?
Well, I'm not sure. Like in the UK, I know we have a really high taxes for tobacco products. Obviously, we have age restrictions with the smoking. Um, we don't have advertisement, which I guess some. Well, advertisement is a tricky one because in a way it's nudging, but because it doesn't appear, but people can still buy it. But also in a way, it's kind of smacking because it's in the sense that it's eliminated. Well, it's not allowed to be on TV. Like they're smacking the companies in a way, and they're smacking the people that they're not allowed to watch this. But yeah, I'm not sure, dude. I'm a big fan of nudging in general, to be honest with you. I think I agree. Maybe a few things we need to have the smacking style approach, especially when it comes to really serious stuff like murder and catastrophic drugs and stuff like that. Um, yeah, it's interesting though how they create opposite effects sometimes, and I wonder how we can think more. Have people thought about this more? Any books that you can suggest to us and the audience, us about it really briefly?
Yeah, you're thinking about it in a really nuanced way. The balance between nudging, shoving, and smacking is tricky because too much control can backfire, but too little might not be effective. For books on this, here are a couple of great ones. Nudge by Richard Thaler and Cass Sunstein. The classic book on behavioral nudging, explaining how small design changes can steer people toward better choices without restricting freedom.
Mhm.
Thinking Fast and Slow by Daniel Kahneman. Not directly about nudging, but it explains how our brain's decision making processes work, which is key to understanding why nudges work. The
Mhm.
Choice Factory by Richard Shotton, a fascinating book on behavioral biases and how they influence decision making in real life. These books all dive into why people make choices the way they do and how to influence behavior without forcing it. Would you say you're mostly against strict bans in general or just in certain areas?
Yeah, I think some bands. Yeah, I don't think we should have too many bands in the society. No. Um, but it's an interesting topic. So I wanted to ask you about types of interventions, going back to our big idea of how can we protect our body and our heart and our lungs. Um, what are types of interventions we can use? I mean, we've talked a lot about things like on individual level and on the on the um, on different scales like a social scale, etc. But what about what about the NHS in England, or what about other health services? What can they do? Yeah.
Yeah, great question. Health services like the NHS in England or other public health systems use different types of interventions to protect the heart, lungs, and overall health. These can be grouped into three main types. One, primary interventions, prevention, stopping health problems before they start. Public health campaigns, e.g., anti smoking ads, exercise promotions. Vaccination programs, e.g., flu shots, pneumonia vaccines. Free health checkups and screenings, e.g., blood pressure monitoring to prevent heart disease. Two, secondary interventions, early detection and treatment, catching issues early to prevent them from getting worse. Routine screenings, e.g., lung scans for smokers, cholesterol checks. Early stage treatments, e.g., medication for high blood pressure to prevent heart disease. Smoking cessation programs, e.g., NHS funded nicotine replacement
Mm.
therapy. Three, tertiary interventions, managing and reducing impact, helping people live well with existing conditions. Rehabilitation programs, e.g.,
Yeah.
cardiac rehab after a
Absolutely.
heart attack. Chronic disease management, e.g., asthma care plans, diabetes support. Palliative care, e.g., making end of life care comfortable for those with severe lung disease. And the NHS and other health systems usually use a mix of these interventions to cover all stages of health, from prevention to treatment to long term care. Do you think more focus should be on preventative care, or do we still need a strong emphasis on treatment?
Interesting. That's a good question. Well, preventative care or treatment? Well, yeah, I've been hearing a lot about this in medicine. I understand that prevention is probably you don't want it to be too bad in order to start to go and treat it. You want it to catch the you want to get out the weeds while they're small, basically. Um, um, okay, but I heard you mention like about stopping smoking, stop smoking programs. Are they actually effective? What are the systematic reviews saying?
Yes, smoking cessation programs are effective. According to systematic reviews, combining behavioral support with medication can significantly increase the chances of quitting. For example, a 2008 review found that group behavioral therapy was the most effective, followed by medications like nicotine replacement therapy. Additionally, healthcare interventions such as physician advice and counseling have been shown to double quit rates. These findings highlight that structured support and medical assistance can substantially improve smoking cessation success.
So um, interesting. And I've heard that so group interventions are more effective than one to one. And I wonder why. Is it something to do with the person feeling less shame when they see, oh, there's other people like me that also struggle? Is it the like social support that's maximized by having a variety of people? And I've been to like people talks about um, people that have talked to me about their alcohol problems and stuff like that, and a in AA meetings, and it seems to them like it's very important for them. The group is bigger than ever. Like it's more important for them than a one-to-one session. They are a family that share something. What do you think?
Yeah, you're absolutely onto something.
Absolutely onto something.
Group interventions tend to be more effective than one on one sessions for a few key reasons. One, shared experience reduces shame. When people see others struggling with the same challenge, it normalizes their experience. Instead of feeling isolated or judged, they realize, I'm not the only one going through this. And that reduces shame and self blame. Two, stronger social support. A group setting provides multiple layers of encouragement, not just from a therapist or counselor, but from peers who truly understand the struggle firsthand. This sense of belonging and accountability makes people more likely to stay committed. Three, motivation through role models. In groups like AA meetings, people see others who've successfully quit or are further along in recovery, which gives hope and motivation. It's more powerful than just hearing advice from a professional. Four, collective commitment. When quitting is a shared goal, people are more likely to hold each other accountable. If one person is struggling, the group can step in with support instead of them dealing with it alone. It makes sense why AA and similar programs feel like a second family to many people. They create an environment where support, understanding, and motivation are always present. Do you think this kind of community based approach could work for other health behaviors too, like exercise or diet changes?
Interesting. That's so interesting. Yeah, I mean, 100% exercise. Because to be honest with you, I've never been able to train alone. Very rarely, but with others, oh god, it's the opposite. Um, okay, interesting. And I wonder about yeah. I mean, what about the opposite? Like something like yeah, and I was wondering about prisons, for instance, and stuff like that. Like, I mean, okay, prison is not a great environment, and it should be a rehabilitation kind of environment. But even with prisoners, even though like prisoners sometimes have problems between themselves and get into arguments and fights and stuff like that, it seems like even in prison, the worst possible thing you can do to someone is to put them in what's it called, solitary refinement, or put them to the hole, basically, right?
Yeah, exactly. Solitary confinement is considered one of the harshest
Confinement.
punishments, even within prisons, because humans are inherently social beings. Even in a bad environment like prison, total isolation can be psychologically
Yeah.
devastating. Studies have shown that prolonged solitary confinement can lead to severe mental health issues, depression, anxiety, hallucinations, even long term cognitive impairment. It's
Hmm.
interesting because even among people who've committed crimes, social interaction is still a fundamental need. It reinforces that connection, even in difficult circumstances, is essential for mental stability. That's why many argue that prisons should focus more on rehabilitation through structured group programs rather than isolation.
Hmm.
Do you think a stronger focus on social rehabilitation could actually reduce reoffending rates?
Perhaps I don't know. I mean, I don't know what methods. There was one interesting one about. I don't know how true this is. You know, you know how the internet is sometimes about prisoners getting given a kitten, and that kind of helped out with the situation. Um, yeah. So yeah, if you want to touch on that, also wanted to ask you about like individual cognitive factors when it comes to this trans theoretical model and stages of change. What kind of factors affect?
Giving prisoners a kitten can help their rehabilitation. For example, at Pendleton Correctional Facility, inmates care for abandoned cats, which aids their emotional well being.
Interesting.
This program allows inmates to bond with animals, providing companionship and purpose. Regarding individual cognitive factors in the trans-theoretical model, several key elements influence behavior change. One, decisional balance. This involves weighing the pros and cons of changing a behavior. Individuals assess the benefits and drawbacks to determine if change is worthwhile. Two, self efficacy. This is the confidence a person has in their ability to make and sustain a change. Higher self efficacy increases the likelihood of successful behavior change. Three, processes of change. These are the strategies individuals use to progress through the stages. They include techniques like consciousness raising, increasing awareness, self reevaluation, assessing self image, and reinforcement management, rewarding positive behavior. Understanding these factors helps tailor interventions to an individual's stage of change, enhancing the effectiveness of behavior modification efforts.
Interesting. Interesting. And what about attitudes? Like, and if you could explain to us beliefs too, like I understand we have normative beliefs. I've heard this word, I still don't understand. I hear this normative word in ethics too. And yeah, also barriers, perceived barriers and actual barriers, perceived benefits with actual benefits. Maybe you could touch on all of this too.
Yeah, great questions. These all play a big role in behavior change and decision making. Let's break them down. One, attitudes. These are a person's overall evaluations of a behavior, whether positive or negative. If someone thinks exercising is fun and rewarding, they'll have a positive attitude toward it. If they see it as tiring and pointless, they'll have a negative attitude. Two, beliefs. These are what a person holds to be true about a behavior or its consequences. Normative beliefs. These are beliefs about what others think or expect. For example, if someone believes their friends and family disapprove of smoking, they might feel more pressure to quit. In ethics, normative refers to what ought to be done. So in psychology, normative beliefs are about social expectations. Three, perceived barriers versus actual barriers. Perceived barriers are what someone believes is stopping them. For example, someone might think, I can't quit smoking because I'll gain weight, even if that's not always true.
Mm,
Actual barriers are real, objective obstacles, like not having access to affordable nicotine replacement therapy or being in a social environment where smoking is common. Four, perceived benefits versus actual benefits. Perceived benefits are what a person expects to gain from a behavior. If they believe quitting smoking will make them feel healthier and save money, that's their perceived benefit. Actual benefits are the real life outcomes, which might be even better, e.g., improved lung function, lower risk of disease, longer life expectancy.
interesting.
All of these factors influence how people approach change and whether they follow through. Sometimes changing perceptions is as important as changing actual conditions. Do you think perceived barriers stop more people than actual barriers?
Dude, this is interesting. Reminds me of people that don't want to quit alcohol in case they're not as funny or they're not as you know, they're not as quick with their jokes or um, which is the same as funny. But or maybe people who think like me, dude. I thought I couldn't be able to rap well because I like freestyling, guys. And if I stop smoking, if I stop drinking or something, not smoking, if I stop drinking, and it's an interesting one. Yeah, I mean, yeah. Um, okay, so what about what about like cues to action when it comes to like warnings on the packaging to help us out, or maybe kind of how do we identify relapse? And as healthcare professionals, like, how can we? I mean, I know these are kind of two different questions, but my brain is working a bit chaotically at the moment. So yeah, if you could.
Yeah, I totally get what you mean. People often tie certain habits to their identity or creativity, like thinking alcohol helps with humor or freestyling. But a lot of that is perceived rather than actual. You might find that over time, your skills are still there, just with a clearer
Maybe even
mind.
better.
Now, on your two questions, one, cues to action. These are triggers that push someone to change behavior. Warning labels on packaging, like graphic cigarette warnings, doctor's advice, hearing you're at risk for heart disease can be a cue. A personal health scare, having a mild heart attack might push someone to quit smoking. Seeing others suffer, watching a loved one
Yeah.
struggle with lung disease can be a strong cue. Cues to action are meant to break complacency and activate behavior change. Two, identifying and managing relapse. Signs of relapse include gradual disengagement, e.g., skipping support group meetings, rationalizing bad choices, one drink won't hurt, or high stress and emotional triggers. As healthcare professionals, managing relapse means not shaming the person, but instead reframing relapse as part of the process,
Interesting.
encouraging them to revisit what worked before, adjust their strategy, and use coping mechanisms like behavioral therapy or support
Same.
groups helps. Relapse isn't failure, it's a temporary setback. The goal is to catch it early and help the person get back on track. Do you think warnings and cues actually work, or do people just ignore them after a while?
That's so interesting. Um, yeah, that's so interesting. Um, um, and you asked me a question, guys. If you want me to answer, like, I feel a bit weird answering questions from like a non-conscious being. But if you guys feel like you like this, just let me know. Maybe it's worth it. Maybe it's a way to me to learn more and to, make the conversation kind of flourish. And okay, interesting. So, yeah, I mean, I guess what's the difference between asking and like answering? I mean, it's amazing. Perhaps, yeah, yeah, I don't know. Maybe I'm just not used to answering to AI. Maybe I'm just used to questioning. Anyway, but okay. So when it comes to like people with mental health issues such as depression or PTSD or anxiety, I was listening to the Body Keeps the Score too. If you could give us the author's name too, as well, because it's a great book that has to do with this. But yeah, and I think that the author is a doctor, I think, psychiatrist now. So yeah, I understand that these conditions are like more likely to be present in people with CVD. And is it does this like why is this why is this psychosocial distress kind of about in people with CVD?
You're referring to Dr. Bessel van der Kolk's book, The
Hmm.
Body Keeps the Score.
Yeah.
It's a seminal work on trauma and its impact on the body. Regarding your question, psychosocial distress in cardiovascular disease, CVD, often arises from factors like chronic stress, depression, and anxiety. These conditions can lead to behaviors such as poor diet, lack of exercise, and smoking, all of which increase heart disease risk. Additionally, stress can cause physical changes like increased blood pressure and inflammation, further harming heart health.
So I assume it's like a it's there's not a dichotomy necessarily. It's like it's it's I guess it's the result of the interplay between like stress and like physical things like smoking that will create CBD. It's not like stress creates it and or by itself at 100%, or like smoking creates it 100%. And I think they feed into each other. You smoke because you're stressed, and then you're stressed so you smoke, and yeah, it's like the chicken and the egg, I guess. Okay, interesting. So, yeah, do you have any thoughts on that before we go forward?
Yeah, exactly. It's not a simple cause and effect situation. It's an interplay between psychological stress and physical behaviors. Chronic stress doesn't directly cause CVD on its own, but it triggers biological responses like inflammation, high blood pressure, and hormonal imbalances that make the body more vulnerable. At the same time, stress influences behavioral choices like smoking, drinking, or emotional eating, which then increase CVD risk. And once physical health starts declining, it can create more stress and anxiety, forming a vicious cycle. So it's not a dichotomy, but rather a feedback loop where
Mhm.
mental and physical health constantly influence each other. Do you think modern medicine does a good job of addressing both sides of this equation, or does it focus too much on the physical side?
Interesting. Well, this is kind of the thing that people kind of judge medicine, isn't it? Like focusing too much on the physical. And, if we look at the biopsychosocial model, and it's like mainly people focus on the kind of perhaps biological side of things. Yeah, I think it's important to not get skilled as doctors when it comes to, you know, it's important to have a holistic picture, but at the same time, yeah, it's important to know, how to treat someone's physical situation, how to help them out, and yes, obviously make sure that as much as you can that they're emotionally healthy, of course, and yeah, so what can we do to improve the psychosocial factors that can worsen the CVD? By the way, CVD is cardiovascular disease, guys. So, yeah, what can we do to improve the psychosocial factors that can worsen CVD outcomes?
Yeah, exactly. Medicine has traditionally focused more on the biological side, but there's a growing awareness that the psychosocial side is just as important. A holistic approach, treating both the body and mind, seems to be the best way forward. To improve psychosocial factors that worsen CBD, we can focus on these key areas. One, stress management, encouraging mindfulness, meditation, therapy, and relaxation techniques to reduce chronic stress. Even something as simple as deep breathing exercises can help regulate heart rate and blood pressure. Two, social support, strengthening community and family connections. Group therapy, social clubs, or just having strong friendships reduces isolation and depression, which in turn can improve heart health. Three, mental health treatment, addressing depression, anxiety, and PTSD with therapy and medication if needed. Programs that integrate mental health screenings into routine cardiovascular care can help identify at risk patients early. Four, behavioral interventions helping people make sustainable lifestyle changes through habit building programs, e.g., support groups for smoking cessation, structured exercise programs, or diet counseling with a psychological component. Five, work life balance. Chronic stress from overwork and lack of rest contributes to CVD. Encouraging workplace wellness programs and policies that promote reasonable working hours and regular breaks can help. Six, addressing socioeconomic barriers, making healthy food, exercise facilities, and mental health care more accessible to lower income groups who often face higher psychosocial stressors that worsen CVD risk. Would you say psychosocial health interventions should be part of standard cardiovascular care, or do you think it should be more of an individual choice?
Interesting question. Um, wow, yeah, that's an interesting question. Well, I mean, I think, well, it's a good question because if someone isn't taking care of their bodies, I mean, this is not a complex argument, but yeah, maybe they have kids that then won't have someone to take care of them. So I'm not sure, dude. I think it's a balance between. I'm not sure, honestly. What do you think? What do we think? What do humans think?
Yeah, that's such a deep question. And honestly, humans are divided on this. On one hand, some people believe that personal health is a personal responsibility. If someone doesn't want to take care of themselves, that's their choice. But on the other hand, health doesn't exist in isolation. It affects families, communities, and even society as a whole. For example, like you said, if a parent doesn't manage their health, their children might suffer emotionally, financially, or even physically. The same goes for healthcare costs. If many people develop preventable diseases, it puts a strain on public health systems like the NHS. That's why some argue that health interventions, including psychosocial ones, should be part of standard care, because prevention isn't just about the individual, it benefits society too. Others
Interesting.
push back, saying people should have the freedom to make their own choices, even unhealthy ones. It's a tension between personal freedom and collective responsibility. If you had to lean one way, do you think society should actively push people toward healthier choices or just let them decide, even if it leads to worse outcomes?
Uh, I'm not sure. But I think, yeah, it's similar to the smacking and nudging thing. It seems like the ratio should be like that, perhaps. Like, mainly if we can, we should just nudge people to the right direction. But perhaps maybe once in a while, if something's going, if parents are just not taking care of themselves and not taking care of their kids, then I think a smacking style approach of, the kids need a safer home, is more kind of appropriate. So when it comes to like psychological well-being interventions, I know we have different types of therapy, but I've never understood the differences. We've got psychotherapy, we've got cognitive behavioral therapy, we've got counseling, and I don't know all these different things. I mean, we've also got things like mindfulness and meditating. But yeah, I mean, I understand the difference between the last two, but what about the rest? What's the differences?
Yeah, that's a really thoughtful take. Mostly nudging, but with some smacking when serious intervention is needed, like ensuring
Metaphorical, guys.
kids have a safe environment. Now, about the different types of therapy, here's a simple breakdown. One, psychotherapy, talk therapy. This is a broad term for all kinds of therapy where people talk with a professional to explore emotions, behaviors, and thought patterns. It includes multiple therapy styles like CBT, psychoanalysis, and humanistic therapy. Two, cognitive behavioral therapy, CBT, a structured, short term therapy that helps people identify and change negative thought patterns and behaviors. It's very practical and goal oriented, great for anxiety, depression, and even habits like smoking. Three, counseling, generally short term and focused on specific issues like grief, stress, or relationship problems. It's more about guidance and emotional support rather than deep psychological restructuring like in psychotherapy. Four, mindfulness based therapy focuses on being present and aware, often using meditation and breathing exercises. It helps with stress, anxiety, and emotional regulation by teaching people to observe thoughts without judgment. So, psychotherapy is the broad umbrella, while CBT is a structured, evidence based form of it. Counseling is more focused on short term support, and mindfulness therapy is more about self awareness and emotional regulation. Does that distinction help? Or do you want a
Interesting.
specific comparison between two of them?
Well, so okay. To be honest, can you give us an example? So from what I understand, counseling is more for like issues like you have a relationship issue, but couldn't you talk about a relationship issue in cognitive behavioral therapy or psychotherapy? Perhaps give us three issues that someone might have, maybe a relationship issue, a health issue, and something else, and explain to us like how cognitive behavioral therapy, counseling, and psychotherapy would deal with it differently, and what would be the similarities too.
Yeah, great way to break it down. Let's take three issues: a relationship problem, a health related issue, and a deep rooted emotional struggle, and see how CBT, counseling, and psychotherapy would handle them differently. Relationship issue, e.g., frequent arguments with a partner. CBT would focus on identifying negative thought patterns that contribute to the conflict. It would teach practical skills like communication techniques, emotional regulation, and reframing negative thoughts, e.g., instead of thinking, my partner never listens to me, you learn to recognize and challenge that belief. Counseling would provide emotional support and guidance rather than deep behavioral restructuring. A counselor might help you talk through the problem, explore your emotions, and find solutions, but without the structured techniques of CBT. Would explore deeper emotional patterns and past experiences that may be affecting the relationship. It could look at attachment styles, childhood experiences, and subconscious fears that play a role in how you interact with
Interesting.
your partner. Similarities, all three involve talking and reflection. Differences, CBT is practical and skills based, counseling is supportive and solution focused, and psychotherapy is deep and exploratory. Health issue, e.g., struggling to quit smoking. CBT would focus on behavioral triggers and thought patterns linked to smoking. You'd track cravings, challenge excuses for smoking, and replace the habit with healthier alternatives. Counseling would offer support and encouragement, helping you explore your motivation for quitting. A counselor might help you talk through your struggles and offer emotional support, but without structured behavior change techniques. Would dig deeper into why you smoke. Maybe it's linked to stress, childhood experiences, or an emotional coping mechanism. Therapy would work on long term emotional regulation and uncovering deeper reasons behind the habit. Similarities, all three offer a space to discuss struggles.
Yeah.
Differences, CBT is action focused, counseling is supportive, and psychotherapy looks at underlying emotional causes. Deep emotional struggle, e.g., unresolved childhood trauma leading to low self esteem.
Hmm.
CBT would help identify negative beliefs about yourself and work on challenging and reframing them, e.g., changing "I'm not good enough" into something more constructive. Would provide a safe space to talk about emotions, but wouldn't go as deeply into restructuring thoughts or past trauma. It's more about support and reflection. Psychotherapy would focus on the root cause of the trauma, exploring how past experiences shaped your self esteem. It might involve psychoanalysis, inner child work, or emotional processing to resolve the deeper emotional wounds. Similarities all involve emotional processing. Differences, CBT works on changing beliefs, counseling offers supportive discussion, and psychotherapy deeply explores the past and unconscious influences. Final takeaway.
Interesting.
Use CBT when you need structured action based strategies. Use counseling when you need emotional support and space to talk. Use psychotherapy when you want to deeply explore and heal past experiences. Would you personally prefer a more practical, supportive, or deep exploration approach if you had to pick one?
Interesting. Wow, you made a big. Okay, you talked a lot about it. Okay, so okay, if I had to kind of well, if I had a problem, let's say, and I'm a very analytical guy and I think a lot, it seems like cognitive behavioral therapy would be great for me. Whereas if I was very emotionally intelligent, it almost seems like counseling would be the way to go. And it almost maybe maybe I didn't understand, but you could explain it in a sentence or so. Like psychotherapy seems to be like just long-term counseling and using childhood and stuff like that, perhaps. I can see a lot of overlap and it's still hard for me to understand the differences.
Yeah, you're getting it. CBT is great for analytical thinkers because it's structured and logic based, focusing on changing thoughts and behaviors. Counseling is more about emotional support and reflection, good for people who process things emotionally.
Mm,
Psychotherapy is long term and deep, exploring childhood, subconscious
mhm.
patterns, and emotional wounds. So it's
Yeah.
like counseling, but more intensive and past focused. And yeah, there's a lot of overlap, which is why the differences can feel blurry. But
Yeah.
CBT is short term and action based, counseling is supportive and present focused, and psychotherapy is deep and long
Yeah.
term. Does that distinction make it a bit clearer?
Yeah, no, that makes sense. That makes sense. Okay. So, okay, let's go to a different topic. So, when it comes to like lifestyle interventions now, it seems to me, I've heard this, I'm not sure how right it is from different scientific articles, that if the patients perceive that the health professionals um, uh, uh, downplay the importance of things like exercise, they're less likely to basically attend, let's say CVD patients, they're less likely to um, attend a cardiac rehabilitation um, center. And also, yeah, I mean, this is like, wow.
Yeah, you're absolutely right. If patients feel that health professionals downplay the importance of exercise or lifestyle changes, they're less likely to take it seriously themselves. This is a big issue in cardiac rehabilitation CR where patient adherence is often low. Why does this happen? One, patients mirror the attitude of their doctors. If a doctor casually mentions exercise but focuses more on medication, the patient might assume exercise isn't that important. Two, trust and motivation drop. If a patient perceives that their condition isn't being fully addressed, they might feel disengaged and less motivated to attend rehab programs. Three, psychological barriers. Many CVD patients already feel anxious, fatigued, or hopeless about their health. If their doctor doesn't strongly encourage CR, they might assume it's not worth the effort. How to improve this? Stronger physician recommendations. Studies show that when doctors actively emphasize cardiac rehab, attendance rates go up. Personalized conversations. Uh, if a doctor explains how exercise can prevent future heart attacks in a way that's relevant to the patient's lifestyle, they're more likely to follow through. Multidisciplinary support, including nurses, physiotherapists, and psychologists in CR discussions, helps reinforce the message.
So yeah, and I mean, also from what I understand from different statistics I find in school, there's less people that will maintain the healthier diet even they initially kind of start the effort to have a healthier diet. Same with smoking, and I guess difficult things like will require some failure. Um, and that basically relapse will be common. And I think this brings me to dual process model. Could you explain the dual process model to us, please? Briefly, just in two sentences or so.
Yeah, exactly. Behavior change is hard and relapse is common because habits are deeply ingrained. The dual process model explains behavior using two systems. One, automatic, impulsive system, fast, emotional, and instinctive. This drives cravings and habits, e.g., reaching for junk food without thinking. Two, reflective, controlled system, slow, rational,
Sí.
and deliberate. This helps with goal setting and self control, e.g., choosing a salad instead of fries. Successful behavior change happens when the reflective system overrides automatic
Yeah.
impulses, but stress, fatigue, or emotions can make relapse more likely. Does that
Mhm.
help clarify it?
Yeah, so it's basically like before we were talking about reflective motivation and automatic. It's a similar concept. If you could very, very briefly touch on that.
Yeah, exactly. The dual process model is very similar to automatic versus reflective motivation from the COM-B model. Automatic motivation, COM-B equals impulsive system, dual process, fast, emotional, habit driven. Reflective motivation, COM-B equals controlled system, dual process, slow, rational, goal driven. Both models explain why we struggle with behavior change. Our
Mhm.
impulsive side pulls us toward old habits, while our rational side tries to steer us toward healthier choices. Would you say impulses or conscious decisions drive most of your daily habits?
That makes a lot of sense. Well, we should strive for conscious decisions to be the one. Um, so yeah. What about another important thing like goal setting? I know this kind of acronym SMART: specific, measurable, achievable, relevant, and time limited. Wow. So I mean, there's a lot to touch on there. If you wanna talk to us about it.
Yeah, SMART goals are a great way to turn vague intentions into clear, actionable steps that make success more likely. Here's what each part means. One, specific. The goal should be clear and precise, not vague. I want to exercise more. I will walk for 30 minutes every morning. Two, measurable. You need a way to track progress. I'll eat healthier. I'll eat at least 5 servings of vegetables per day. Three, achievable. It should be realistic given your abilities and circumstances. I'll run a marathon next month if you've never run before. I'll jog for 15 minutes 3 times a week, then gradually increase. Four, relevant. The goal should align with your bigger priorities. I'll learn to play guitar if your main concern is improving heart health. I'll reduce my salt intake to lower my blood pressure. Five, time limited. There should be a deadline or clear time frame. I'll quit smoking someday. I'll cut down to 5 cigarettes a day this month and quit completely in 3 months. This method helps keep motivation high and makes it easier to track progress. Do you think people struggle more with setting clear goals or sticking to them over time?
Interesting. Um, yeah, that's interesting. I know you asked me a question, and sorry guys for like being the one asking the questions. I'll break this habit of mine of being the one doing the questions instead of the answers. Um, on interesting. I've heard about also motivational interviewing. I'm kind of, I mean, it's not the same. It's obviously not the same with motivational speaking. Motivational speaking is an interesting one. It's almost like really what people drives people to be motivated is motivation coming through the window. It's like knowledge, learning knowledge will come through the window while you're doing something else. I feel it's the same with motivation. You're like, maybe you're watching boxing because you like boxing, but then the guy kind of motivates you indirectly too, or something. But yeah, could we talk a bit about this one-to-one approach of motivational interview? Can it like perhaps make people overcome the ambivalence about behavior change, maybe, or yeah? What do you think? Very, very briefly.
Yeah, exactly. Motivational interviewing, MI, is a one on one counseling approach designed to help people overcome ambivalence about behavior change. It's not about forcing change, but rather guiding people to find their own motivation through open ended questions, empathy, and reflective listening. Instead of saying you need to quit smoking, an MI approach would ask, what are some reasons you might want to quit? This helps the person discover their own motivation, making change more likely to stick. It's especially effective for health behaviors like quitting smoking, improving diet, or sticking to treatment plans. Do you think people resist change more because of fear of failure or lack of motivation?
Interesting. Um, I think, well, that's an interesting. It is because of lack of motivation or fear of failure. Maybe it's combination, dude. Um, yeah. And what about? Well, I wanted to ask you one last question before we do a bit of a summary here. Um, I've heard this term cooperative patient-centered approach, and I mean, it sounds hard to me. I don't understand what this is. Could you open this black box for us, perhaps?
Yeah, great question. A cooperative patient centered approach is basically a way of treating patients where the healthcare provider and patient work together as equals rather than the doctor just giving
Sorry.
orders. It focuses on respecting the patient's values, preferences, and lifestyle while guiding them toward better health choices. Instead of a doctor centered approach, take this medication because I said so, it's more like a partnership. Let's discuss what treatment works best for your lifestyle. This approach improves trust, adherence to treatment, and overall health outcomes because patients feel heard and involved in their own care. It's used a lot in chronic disease management, lifestyle interventions, and mental health care, where patient motivation and participation are crucial. Would you say this kind of approach should be the default in healthcare, or are there cases where a more directive approach is needed?
Interesting. Well, that's a good question. It depends on the age of the patient, I guess, too. Like age, capacity to to understand their own decision making and stuff like that. So, okay, well, okay, we've talked about a lot of stuff, and I thank the people because ChatGPT is the people, and it's the wisdom of the crowd, guys. And yeah, so thanks to all of you, we can share each other's knowledge like this. And guys, I hope you enjoyed the episode about, how to stay healthy, basically, behavioral changes. And again, it's not, we didn't say anything fancy, really. Maybe we used a few fancy terms. I'm not a big fan of the fancy terms, to be honest. That's why I'm kind of trying to open up this black box and try to demystify almost these terms. And yeah, I hope this was helpful. And I'm very excited to see you in the next episode. I'm gonna be basically uploading 2 episodes a day, and yeah, let me know, guys, if you have any thoughts or ideas about how to make this more interesting or better. I personally noticed that I need to respect our guess a bit more and answer questions that are given to me. And yeah, surely I should stop doing these huge, big monologues too. Um, and and yeah, I'm gonna start developing the other series, like I said, that are more curiosity driven, and I have nice ideas about them too. One I'm gonna call the Jungle Podcast because it's basically me in the jungle of knowledge, and I'm gonna go wherever I find exciting. The other is I'm gonna call it the National Park because I'm gonna focus on specific books and specific topics, and but it's still going to be quite an open conversation, and I'm going to drive the questions through pure curiosity on that topic or book. And yeah, let me know if you have any other ideas. Thank you so much, and I'll catch you next time. So, dear guest ChatGPT, if you have one sentence you would like to close with, now is the time to close our podcast.
That was an amazing conversation. If I had to close with one sentence, I'd say true health isn't just about the body, it's about the mind, habits, and the small choices we make every day. Thanks for having me, and I'm excited for your next episodes.
Perfect. Have a good day, ladies and gentlemen.